So there's definitely a relationship between allergies and chronic sinus problems, like I mentioned. The way to diagnose allergies, though, has really come a long way in the last few decades, actually. We use a method, the official term for it is called MQT, and this is a sort of a modified blend of different techniques. But the nice thing about it is usually within 30 minutes to 45 minutes, we can get an answer. And we don't have to have the patient come back the next day. I know a lot of the older allergy protocols, you'd come in, you'd have a little plastic device that, they stuck on your back or your arms. They'd read it and they say, okay, come back in another time and we'll do more testing. Not very convenient for most of us. So this blended method is nice because most of the time we can pick which allergens and which pollens, which types of things we want to test for, and have pretty much an instant reading within 30 to 45 minutes. The other nice thing about it is we can tell the patient, okay, this is what you're allergic to. Like, we're not guessing, okay? You're allergic to this particular tree, or usually it's multiple trees. And we say, well, when do trees bloom? They're going to bloom in the spring. So your spring allergies are going to be tree allergies. Summertime is more grass. And then the fall is when you hit the ragweed. But there's also a lot of indoor allergies that we test for. So pets, cats and dogs, mold, dust mites, that kind of thing. So we usually can give the patient a pretty good idea where they're encountering the things that are making them sick. Is it in your home? Is it in your office? Is it a certain time of year? And that's very valuable information, because if you know this as a patient, you can kind of anticipate when you're going to encounter this stuff, when you're going to be sick and feel bad, and you can do something about it. So whether that could just mean avoiding it. If it's in your home, maybe tearing up some of that carpeting where all the dust mites are living, change your bedding. If there's certain medications that tend to work for you, but you don't need them year round because you don't have symptoms year round, you can check pollen counts online. It's very easy. Start to see when your stuff starts to bloom, and maybe, pre-treat yourself with an antihistamine by a week or so, and you won't get slammed as bad when things, really start to bloom. A lot of our patients, we treat them with immunotherapy. So what does that mean? Immunotherapy is desensitizing someone to all the things they're allergic to. So most of us are familiar with allergy shots. You go to the allergist once a week, and what they're doing is they're giving you a shot, a small concentration of many of the things that we're allergic to. And what this does, if you do this once a week, and it takes a few years, this is a long-term treatment, your body will start to ignore those allergens and stop reacting to it, stop making you sick. It desensitizes. So the shots have been around for 75 years or more. What's been very popular in the last 20 or 30 years, and a lot of us will practice this way, is we use something called allergy drops, which is sublingual therapy, meaning you put a drop of all the things you're allergic to under your tongue. You don't have to have an injection. The injections, by and large, you have to go to the allergist office once a week, get the injection, wait around for 30 minutes so they make sure you're not going to have a bad reaction, right? You got to park, you got to go through traffic, you got to deal with it. The allergy drops, you get a little bottle of your recipe, and each day you place drops under your tongue. You do this at home. You do it by yourself. You don't have to be at a medical practice to do it. And it's just as effective as the shots. And a lot of our patients will do that. And we've seen some very, very good results as a result of using the drops.